Hi everyone, so I'm going to share with you about my research paper. So my paper was on cognitive behavioral therapy for individuals that are struggling with generalized anxiety. And I think that there are a lot of individuals that struggle with anxiety on a daily basis, and especially during and even so after COVID-19, many individuals will continue to struggle to have that healthy mindset and not lapse into those negative thoughts. So, the purpose of this group is to really bring individuals together from the ages of 18 and older to discuss the changes in their lives, what triggers their anxiety, and helping coping skills to help them work through their anxiety. I think group members would be able to really share their experiences and provide support for one another through the group's discussions and the activities within the group as well. And the main goal of this group, honestly, is to eliminate or reduce the group members' anxiety and really just increase their coping skills. Um, so, there are a few things that I decided in the creation of this group to really just ensure the success of this group as a whole. I think that this group would be much better as a smaller group of no more than about 6 individuals. In creating a group that helps individuals struggling with anxiety, I think it is more beneficial to have a smaller group because it really provides more of that individualized attention for members, and members might be more willing to share and participate in discussions and activities in comparison to having a larger group. I think the group would also have a closed membership, meaning that no more individuals can be added to the group after the program or therapy sessions have started. And this would again just really help to cultivate that environment of trust, privacy, and enhance emotional support for the group as a whole. Um, I really do think that beginning a group is very exciting and nerve wracking time for not only the group members but for the worker as well. And for this first session with the group, I really want to just focus on creating that safe space, understanding the purpose of this group, and starting to get to know one another. I think that round robin is really a great way to start introductions, and as the worker, I also want to make sure that I introduce myself as well. So, the intervention technique that I really wanted to use for the group that's seeking to help individuals struggling with anxiety is cognitive behavioral therapy, or CBT. And really, the primary goal of cognitive behavioral therapy is to just unravel any cognitive distortions um, through group members really becoming more aware of their distortions in order to help them face their difficulties and achieve their goals. So, when an individual's automatic thoughts are negative and their core beliefs about themselves are negative, this can significantly impact an individual's ability to be able to cope with their anxiety. And there are multiple methods, honestly, within cognitive behavioral therapy that explores these cognitive misconceptions. So, in an article or in a journal article that I looked at by DiTilio and Hanna, they really talk about cognitive behavioral therapy, and they specifically talk about collaboration and guided discovery. So, guided discovery specifically involves learning through discovery, being guided by a therapist, and learning just through the negative thoughts of an individual and how to counteract those negative thoughts with positive statements. And then I also mentioned collaboration as well as another important aspect, as this process of collaboration begins by just really creating this strong therapeutic alliance, which then helps patients with his or her automatic thoughts process. And I think this is really great within a group setting, because when group members are able to begin to express their thoughts and emotions, this will not only help the worker, the individual, and other group members to explore and continue in this process of cognitive restructuring. So in my paper, I kind of provide a detailed outline of what I would kind of want a session to look like. Um, I wanted to really focus on more of that middle of the therapy session, so I focused on the fourth session and really wanted to pinpoint on cognitive restructuring, which is definitely one of the main focuses of CBT. So at the beginning of my group, I kind of talk about the importance of having a 15-minute introduction, just to check in with the members, see their progress toward their individual goals, what do they think the progress is towards the group goals, reviewing last session as well, and outlining the present session in addition to that. Then I want to incorporate an activity, and so this activity, I provide group members with a list of negative cognitive beliefs and have them discuss with each other what negative beliefs really resonated with them the most and why. And after they're able to identify that and discuss that, I would ask them to think about a positive cognitive thought to counteract the negative ones that they were able to point out. Again, this is helping with restructuring their thinking. The next part of that activity, I would really just want to help them think about a specific situation. So I'd provide them almost like a role-playing kind of thing, asking them to identify what is their automatic thought when they read about that situation, what emotion is attached to that thought, and then also asking them, okay, what's a rational thought? Like, what's a rational thought to that situation, and what's the emotional outcome of that rational thought? Again, this activity is all part of the guided discovery for CBT, and really helping members realize their faulty thinking and reframe their thoughts. The rest of my session, I kind of talk about just having time to discuss that activity. I provide an educational piece as well, that again just kind of talks more about what cognitive therapy is, the benefits of it, some of the science and education behind our brain as well. And then I provide another activity, more reflection, and conclude by summing up what we've done in our session, asking for questions, clarification, and what to kind of expect for the next session. So then in terms of thinking about what are the best evaluation measures, and I think the most effective way to really determine whether cognitive behavioral therapy was most effective for individuals struggling with anxiety would be for really members to self-evaluate their individual and group progress in reaching goals. Because really monitoring of this type really just helps to encourage members to provide periodic feedback that can be used by workers to really just improve the practices throughout the whole life cycle of the group. Ideally, what this would look like would be that every other meeting, members would just be given the choice to fill out a short questionnaire, or if they really wanted to, they could discuss the performance of the group or the performance of themselves with the worker. In this questionnaire, it would include kind of a mix of the short closed-ended questions in addition to open-ended questions to really just obtain all of that information about the satisfaction of group meetings and the progress on the group and individual goals. I think this also may be a little bit advantageous on top of the group member self-monitoring, but I really liked how in Tosland and Rivas' book that we had for this class, talking about summary recordings for the meetings, and I think that this would really provide two different viewpoints to really compare the progress that's being made from a group member's perspective through their self-evaluations and the worker's perspective as well through the summary of the meetings that are being had for this group. So this would just mean that as the worker, I would need to ensure that I record the information from the group session as soon as possible after the meeting in order to remember the events as most accurately as possible. So that's a little bit about my paper and cognitive behavioral therapy and what that looks like with individuals struggling with anxiety.